This is another topic where you've been learning things about chemistry that you can apply in a new setting, just understanding the basics. When you go get a blood test as part of your physical, you'll get some numbers back on HDL and LDL levels in your blood. And they talk about them being cholesterol levels. So what does it stand for? HDL stands for high-density lipoprotein, and LDL stands for low-density lipoprotein. So how can you tell them apart? One way is to measure the density of these particles as you separate them. High-density particles are going to have a density around 1.06. They actually have a pretty consistent density. And low-density particles, low-density lipoproteins, will have a smaller number for their density, just a little bit denser than water, which would have a density of 1. So you understand the words density and can differentiate between high and low. Lipoprotein. Lipo refers to fats, and protein refers to proteins. So you can tell from the name that it has two major components. The fat component is largely cholesterol. And these molecules, well, no, it's not largely cholesterol, but cholesterol is a significant portion. And in high-density lipoproteins, it's a small portion, around 2%. In low-density lipoproteins, it's a much higher proportion, around 8%. The protein content is a large part of high-density lipoproteins, around 50% or even more. In low-density lipoproteins, the percent of protein is around 20 to 25%. And the protein makes it denser, the fat makes it less dense. So the part that we haven't listed is largely fats other than cholesterol. So much higher fat content in low-density lipoproteins and much lower in high-density lipoproteins. So you can use this information and your understanding of some of these chemistry words like lipo and protein and density to understand things when you go to the doctor.